Hi, how are you doing today?
Good, how are you?
I'm good. My name's Maya and I'll be your nurse today.
Okay.
What brings you in?
Just a general checkup.
Okay. Are you having any pain or?
No pain.
Okay. I'm gonna go ahead and take your vitals to start out with. Could you just tell me your date of birth?
7/3/89.
Okay. Oh, let me wash my hands real quick before I start. Okay. I'm gonna go ahead and take your blood pressure in both arms today. Does that feel snug enough?
Yep.
Okay. And do you know what your blood pressure typically runs?
Usually about 120 over 70.
Okay. Okay, I got 122 over 70 on this side. I'm gonna go ahead and do your other arm real quick. Lift that for me. Okay. Okay. And 122 over 72 that time. So everything is normal. That's a good range.
Good.
Okay. I am just gonna assess your pulse real quick. Okay. You had 75 for your pulse. Respirations are normal. They're at 13. Go ahead and take your temperature real quick.
Okay.
If you could just lift your tongue out for me, I'll stick this under your tongue. It's the longest temperature thing I've ever.
Mhm.
Doesn't want to beat. ask you questions, but now's not really the time for that. Okay, we're just gonna say that 8. Okay. You are 97.9, so you are normal. Okay, and now I'm just gonna do an assessment of your skin. So if I could have you roll up your sleeves a little bit. Are you having any issues with your skin at all?
No
Okay.
issues.
Your skin feels pretty dry. It's a little bit warm, but still kind of cool. Everything looks normal to me. Do you have any tattoos or piercings?
I have tattoos on both my arms and my left foot, and I do have a nose piercing as well.
Okay. Any lesions or sores, wounds, or anything
Nope.
that I should be concerned about? Okay. No rashes or swelling or anything?
Nope.
Okay. Perfect. I'm just going to test your skin turgor real quick. So right above your clavicle, I'm just going to pinch it a little bit. Okay. And you seem nice and hydrated. Your skin bounced right back. So, and it also feels warm up there, and the color's normal. Okay. Next, I'll look at your nails for a second. They look good. They're nice and not brittle or anything. Your capillary refill's good. It's about 2 seconds. I don't see any sores or anything, and they feel normal. So, okay. And could I have you put your fingers together like this? I'm just gonna test to make sure. They should be at a 160-degree angle. Everything looks good. Next, we will look at your head and neck. Everything looks nice and aligned. Your eyes are nice and even. Your eyebrows are even. Your nose is in the middle of your face.
Goodness.
Your ears are nice and symmetrical. Have you had any issues, like with your head at all? Any bumps or lumps or anything?
Nope.
Okay. I'm just going to kind of feel a little bit around to make sure that I don't feel anything, if there's no tenderness or any pain. Okay. Do you feel any pain at all?
Nope, no pain.
Okay. That is good. Okay. And then I'll just feel your temporal arteries to make sure everything is good. Yep. Okay. Okay, and then I'm going to feel your carotid arteries on the side. I should probably feel those one at a time. So I don't make you
don't wanna pass out.
Okay. And then as far as trachea is nice and lined in the middle. Can't feel any swelling of the glands at all. Are you having any pain or tenderness? Okay.
Nope.
I'm just going to listen real quick to make sure that I don't hear anything abnormal. Okay, everything sounds good. I don't hear any bruits or abnormal sounds. Okay. Okay. And I'm going to do this one more time, and I'm going to have you swallow. Okay. Everything moves normally like it should. Okay. Now I'm gonna have you try and touch your ear to your shoulder on both sides, and then do little neck circles. You put it back and forward. Okay. You have a nice range of motion, so I'm not too concerned. Was there any pain while you were doing that at all?
No.
Okay. And then can I have you just shrug your shoulders up and down? Okay. It's normal. You have some nice resistance there. Okay. And next I'm going to look at your eyes. Like I said before, your eyes look nice and aligned. Do you wear contacts or glasses?
Yeah, I have contacts in right now.
Okay. And are you nearsighted, farsighted, both?
I think one and one and one of the other, but I don't know
Okay.
for sure.
Okay. Let's see here. Make a note that you wear contacts. Okay. And I am just going to test your visual fields real quick.
Okay.
Go ahead and look at this and just follow it. Okay. And I'm gonna come in. Okay, everything moves just as it should. Okay. And I'm gonna have you stand up really quick, and I have a Snell eye chart over here. And you always have your patient stand 20 feet away from the chart. And this measures for visual acuity and, excuse me, how far they can see. So if you don't mind starting at the top and just reading from left to right, then.
Should I read the smallest line down that I can read?
Yes.
Okay.
Yep.
That's, I just wanted to make sure.
Yep.
So I can read line A, D, E, F, P, C, T, E, C, P, O, T, E, C. Sorry.
You're fine.
Okay. And then D, E, F, P, O, T, E, C.
Okay. Thank you. And then. Okay. And then I'm going to grab this little chart here, and I'm just going to have you do the same thing, but I'm going to bring this closer to your face and just go ahead and read it from top to bottom. And
Okay. 958742843 638 8745 63925.
Okay. Thank you. Okay. Okay, and now I'm just going to test to see if your pupils will dilate when I shine this light in there.
Okay.
And we have to remember our perla, which is pupils are equal and they're round and they react to the light. So, okay. Okay, and they're dilating normally like they should. Okay. So as I said, your eyebrows and eyelashes look normal. And I'm going to just like lift down your eyelid for a second just to make sure that everything looks normal on the inside of your eye. Okay, nice and pink, no drainage or anything. Okay, looks good to me. Okay, and next we're gonna do your ears. Feel nice and cool. I don't see any redness or swelling. Have you had any pain in your ears recently?
Nope.
Okay. I'm just gonna look inside them for a second, and I'm looking for the tympanic membrane. Look inside there. It should be pink. There should not be any drainage. Everything looks normal. Good job cleaning your ears today.
Thank you.
Okay. Okay, and then I'm just gonna do a little test to test both sides of your ears to make sure that your hearing is equal on both sides. So I'm going to whisper 3 words, and you just repeat those back to me, what you hear. Give me 1 second to think about those words.
School book grades.
Yep.
Run, jump, kick.
Good job. Your hearing seems to be normal. Have you noticed any changes in your hearing at all?
No.
Okay. Okay. And then your nose is perfectly lined. You have never broken your nose or anything, have you?
No.
Okay. I'm just going to feel your sinuses up here to make sure everything feels normal. Doesn't really feel puffy at all. Have you had any like issues with like sneezing or allergies or like?
I do have a little bit of allergies, but it doesn't really bother me too bad.
Okay. And when you're sneezing, is the stuff coming up, is it like clear or?
Yeah.
Okay. That's good. That means that there's no infection. Make note of that. Okay. And now I'm just going to have you push down one side of your nose, and then I just want you to inhale, and then with your other side. Okay, you sound pretty clear. So that's good. Okay. Okay, and then I'm going to feel your other sinuses right up here. Does that hurt at all? Is there any pain or tenderness? Okay. Okay, and next we're going to look at your mouth. Your mouth appears to be equal on both sides. Your lips are nice and pink and glossy. No, I'm joking. Okay. And I'm just going to have you open up your mouth, smile for a second, and look at your gums and your teeth. Everything looks nice and straight. Did you ever have braces?
Yes.
Yeah. I fortunately did not have to. I've heard it's a lot of pain though. So.
It's not too bad once they actually like, get on and.
Yeah, it's worth it though.
Yeah.
Okay. Okay. And then I'm going to have you say ah for me.
Ah.
Okay, your uvula, everything looks good. Do you still have your tonsils?
Yeah.
Okay, let me look one more time then. Okay. Yep, I see them now. Okay. And it doesn't appear that you have any lesions or sores in your mouth. Did you ever get canker sores or anything?
Mm-mm.
No? Okay. That is completely normal. Okay. Let's see here. And then now is the time where you would evaluate your patient's gag reflex, but I really do not want to gag Sam right now. So normally you would take a tongue depressor or like a cotton swab or something and go as far back as you can to make sure that your patient's gag reflex is normal. Okay. And then I am going to put my fingers right here and I'm just going to have you open your jaw. Okay, can you move it side to side for me? Okay. I don't hear any popping or clicking. Is there any pain when I do that at all?
Nope.
Okay. Perfect. Okay. Okay, and now I'm just gonna look at your chest, everything. Well, I'm not gonna like stare at your chest, but like yours. Okay. Okay, your posture appears to be normal. Do you ever have any issues breathing? Do you have a history of asthma?
No.
Okay. Let's see here. I'm gonna take a listen real quick. Hold on 1 second. Okay. Just gonna listen to your lungs for a second and your breathing. just take some nice deep breaths for me.
Okay.
Now's the time when you can listen for the apical pulse, and you're supposed to do that for a full minute, and it should be between 60 and 100. Okay, I'm gonna have you lift up your arm for a second. I'm gonna listen to the sides. Okay, and your other side. Okay, did you have any pain at all?
Nope, no pain.
Okay. Now I'm just going to do this on the back side. So again, some nice deep breaths. Okay, your lungs are nice and clear. I don't hear any wheezes or rattles or anything else. And you said that you didn't have any trouble breathing at all?
Nope, not.
Okay. Okay, and then I'm just gonna listen to your heart really quick. Okay, and everything sounds normal with that. Nice love dove sound on there. And then this is the time too to inspect the jugular vein. The vein should not be protruding at all or anything that could be a sign that there is fluid buildup. So I do not see anything. And since you said you don't have any pain in there at all, then everything seems to be normal up there. Okay. Now I'm just going to assess your bowel sounds. Have you been having any issues going to the bathroom at all? Everything's been normal? Okay. Yep. If you don't mind laying down, I'm just going to have you Okay, everything sounds normal. If your patient had abnormal or there was lack of bowel sounds, you would listen 5 minutes in each quadrant. And if you still don't hear anything, most of the time you would go grab someone else and make sure that it's not an issue with your stethoscope or anything. So yes. And then next I'm gonna have you lay back down for 1 second. You're fine. And I'm just gonna palpitate your abdomen. Make sure you don't have any tenderness. Bladder is nice and flat. Nothing seems to be distended. Are you having any pain at all when I'm pushing? Okay. And you are good to sit up.
All right.
Okay. Okay. And then I'm just gonna look at your arms real quick again. I'm gonna test your brachial pulse up here. Sure. It's about at a 3 with your other pulse. Your pulse is not bounding, but it's normal, so that's good. Okay, and while I'm doing that, I'm just gonna assess your other pulses. So feel behind your knee for your popliteal pulse. And if you don't mind taking your shoes off for a second, I'll feel on the top of your foot.
Hopefully my feet don't stink.
Nope, I hope so. You're good. Okay, I'll feel behind your ankle. Okay, very good. Okay. And you, of course, have the correct number of fingers. Your arms do not appear like one's longer than the other. Everything looks very symmetrical. Same with your legs. You have all your toes, so that's good.
Yes.
Okay. Okay, and now I'm just going to feel your shoulders a little bit. Everything's nice and aligned. Any pain at all?
Nope.
Okay, and then I'm just going to test. Okay, everything's nice and symmetrical when you breathe. Okay, now I'm going to have you stand up and we're going to do some range of motion exercises.
Okay.
We already did it on your neck and your head, so I'm just going to have you again like shrug your shoulders up and down. Can you move your shoulder around? Can you like bring your shoulders back together on your back, bring them forward? Okay, good. And then if I could have you put your arms out and like flex them up. Okay. And then your hands, if you can roll your wrists like this, put them out straight, move them side to side, move your fingers, spread them apart, move your thumbs out and in. If you can touch your fingers to your thumb. Okay, everything looks good. And then as far as your legs, if you could bring your leg out like this, bring it back a little bit, bring it back a little bit farther.
I feel like I'm ice skating.
Circle out, circle in. Okay, bring it out this way, bring it in. Okay, good job. Now I'm gonna have you walk heel to toe just for like a few steps. Okay, good job. You have a nice gait. I don't see any concerns with the way you're walking, so.
Good job.
Okay,
Are you
and
giving me a
then
hug?
no, and then I'm gonna have you stand with your eyes closed and feet together. Okay, here. I'm
Sorry.
gonna study you. You're fine. And just go ahead and keep them closed for a second. Okay, you have good balance, so you're good there. Okay. Okay, now I'm just gonna have you push down on my hands from the top. Go ahead and put there. Okay, and then we'll switch, and I'll push down on yours. Okay, and then if you can squeeze my fingers for me, a little bit harder. Okay.
I didn't want to hurt you.
No, you're good. Okay. And then I'll go ahead and have you sit down again.
Okay.
And I'm going to have you close your eyes and just go ahead and tell me when you can feel my finger brush across your face.
Now. 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 Now.
Okay, good job. see here. I'm going to do one more test on your eyes that I forgot to do earlier. So I'm going to have you cover this eye, same as me. And I want you to tell me when you can see my finger.
Okay. Yep. Yeah. Yeah.
Okay, other eye?
Yeah. Yep. Yep.
Okay, good job. Okay, and then I'm gonna look at your back for a second. Have you ever had any issues with back problems at all?
Nope.
Okay. No history of scoliosis or any curvatures?
Nope.
Okay, your spine feels nice and straight. And then I'm going to go ahead and have you just point your toes and then go ahead and flex your feet. If you can kind of circle them a little bit. Okay. Everything looks good. Okay. And your hips look nice and aligned, and when you were walking too, everything appeared to be straight and normal. And then I'm just gonna have you smile for me, then frown, then wrinkle your forehead, then move your eyebrows up and down. Okay. Oh my goodness. That was funny. Okay, if I could have you puff out your cheeks for me. Okay. Okay. Do you have any questions or comments for me about anything? before we
I
go?
don't think so. I think I'm good.
Okay. Thank you very much for letting me do an assessment on you.
Thank you.